Our next speaker is Dr. Narayana Reddy. Sir is going to talk about principles of sex therapy. Dr. Narayana Reddy is an MBBS, PhD, FICS, is a diplomat of sex therapy, consultant sexual medicine therapy institute at Daga Institute, Chennai, and Apollo Hospital. Is a past president of Asia Oceania Federation of Sexology, chairman emeritus of Council of Sex Education and Parenthood International. Is a patron of the Indian Androgen Society, associate editor of Journal of Sexual and Relationship Therapy. His most prestigious awards are Distinguished Fellow Award of the American University, Lifetime Achievement Gold Medal Award for the world. Is the first medical professional to start an exclusive sexual health clinic in South India and Tamil Nadu in 1982. Acts of you, sir. Waiting to hear the purpose of this term from Dr. Narayana Reddy. Please be quiet. Kindly maintain the decorum.
Now, two things before I start my talk proper. One, I would strongly recommend every one of you to follow what Dr. Kothari has told you about history taking. Because today we have IAEF, SHIMS, premature ejaculation index similar, all of them are absolutely useless. I tell you why. Because for a pharma company to get approval from US FDA, they require standard data. The standard data can be obtained only when you're giving that type of questionnaire. Now, what are the learning objectives of what I am going to talk to you now? The clinician will understand the rationale of sex therapy. Once you understand the rationale, you will be able to apply this in your clinical practice if you have to undertake sex therapy. That is the objective. What will be the content? One, explanation of sex therapy, the formulation, groundwork to be undertaken before sex therapy, dynamics of therapeutic action, list of sex therapeutic strategies, guidelines for therapists, vicious circle of failure, and breaking it. I have to skip some of that, but I'll focus on sex therapy. Now, people are confused between counseling and therapy. As Prabhupada clearly mentioned, helping the client to help himself or herself. That means, this is problem. I cannot step into his shoes and solve his problem. He has to solve his problem. He is directionless. I am helping him to do that. So a counselor is doing that. It's non-direct. Whereas therapy, any therapy, is a more directive form. You tell the client what you should do. It is not non-direct, it's direct. There is a reason for that. That's also will explain. Now, what exactly is sex therapy? People have heard about chemotherapy, hydrotherapy, all the therapies. But what exactly is sex therapy? The simple definition, form of psychotherapy integrating biomedical and psychosocial components and the treatment of sexual problems. The hallmark is you prescribe certain specific structured sexual tasks. That's the distinctive feature of sex therapy. See, in the Western countries, you have a urologist and you have a psychologist. The clear-cut distinction. In India, doctors are trying to be both. So you have to understand that you have to amalgamate both these. Sex therapy is not teaching the couple how to do it. For that today, on smartphone you can see any blue film. Your parliament and everywhere, MLAs and MPs are watching that. So you don't require a doctor to teach them. It is to help remove anxieties, change attitudes and behavior so that the normal response is not easy. If I don't crack a joke, I'll feel I'm useless after Prakash Matas. I can't talk to him about shares and others because my Hindi is not yet into his absolutely there. Right. Long I talked about 30 years back. Before SSRA available in Indian market, I gave a lecture in Madras Medical College. After that, MS postgraduate came to me. Problem was so-called premature ejaculation. The only tool I had was sex therapy. Stop, God, whatever it is. I told him that you kindly bring your wife. He said, sir, problem is my wife should have taken my wife. I said, no, that's the only way I can help you. But since there are nobody else to go to, he has to agree. So, after about 1 month, he brought his wife. I knew that brought his wife because my secretary told me. But he opened the door and said, Dr. Reddy, are you 100% sure I have to bring my wife? I know she's already waiting outside. I said, yes, fine. Then the second thing, he opened the door again. Dr. Reddy, do we have to undress ourselves? I said, choice is yours, but I am going to keep my dress on. Then finally came the bombshell. Doctor, do we have to do something here and show it to you? I said, and the most dangerous bomb was atomic missile. Sir, will you and the madam and secretary do something and demonstrate that person? I said, I would very much love to do it, the husband will kill me. So, people expect sex therapy means that we are going to teach them how to do it. It is not for that. Well, I'll skip through that very quickly. The idea is when you think about sex therapy, there has to be a rationale why you're doing it. And you have to explain to the client the rationale way. And that's very important. The content of this foundation is what exactly is the problem. You have to describe by yourself and to other person. Very important. Because sometimes they don't think what they have with the problem. Even a man with a premature ejaculation will first come and say, I am weak in sex. That's the word they do not say erection, ED and all. Today, qualified fellows come and talk Dr. Reddy, I have ED. But the common person will say, I have weak in sex. So we have to describe. Then, what are the factors which are leading to this problem? That also you must first clearly understand. Only then you can understand. Here is the groundwork. I am basically following Helen Kempan's one. You can't read it, I don't forget about that. So finally, he's here to decide. The problem is there, you identify the problem due to psychological factors or organic factors or mixed factors. If it is psychological, how do you handle that? If it is organic, how do you handle that? That's what this slide shows. Now you must evaluate that the client or couple have a sexual problem. Why does this question come? I think Prakash Mambhat was mentioning that. The same problem I had. Again, I had a medical graduate. He came to me. Yes, Sunny, what the problem? I said, sir, I have a premature ejaculation. I said, since when is that you are having sex with your wife? Sir, I am not married, sir. If you are not married, how can you say that you have premature ejaculation? From his perception, any ejaculation before marriage is premature. After marriage is mature. See, the problem, people may not have the problem. Like people are worried that their penis is not going deep enough to strike the wife's uterus. Why? Because wife is not enjoying. The fellow has not spent time on foreplay and he has got premature ejaculation. That is why she is not satisfied. He doesn't understand that. He thinks it's not going deep enough. So you have to first find out whether the person has really got a problem or not a problem. If you think he's got a problem, what are the causative factors? They have to identify. Organic, psychogenic or mixed. If it is psychogenic, what are the immediate factors? What are the remote factors? Immediate is something happening here and now. Remote means something which happened in my childhood. Then, are there any associated psychiatric problems? Dr. Papari was mentioning was talking about mania, schizophrenia, etc., etc. All that you should rule out before you undertake sex therapy. Because therapy is not going to work out for this client. One, as a client and a regular partner, very, very important. If he does not have a regular client, there is no point in taking sex therapy also. That's very important. And what are their treatment expectations is very important for you to understand. I'll give one example. Before advent of SSRIs, sildenafil citrate, all those things, we had no option. The only drug available was, in those days, Sustanol. And the only thing for all against right? So people used to come to me, ask me, I used to counsel them, spend time. Finally, write a placebo, send it. They go to my secretary, doctors, is it only this much? That's what I put out to the secretary. Sir is asking only this. I said, only this. Still patient is not satisfied. Now what is patient expecting? Like a quack, for the money which I have taken, I give a bottle of Basma or some lady or something else. So this is expectation because we call ourselves what are you a sexologist. When you say sexologist, practically you are not distinguishing between ourselves and the Hakim and Sabloki, etc. So they expect only that. So you have to be very careful. And have the client and the partner understood the need for sex therapy. Unless they understand the need, you cannot undertake. And most important, are they willing to spend time and resources? Simple, I'm telling you. You are going to undertake sex therapy for about say 6 sessions. For every session you are going to charge in something. Today when what is happening, how the pharma companies are marketing for organic, psychogenic or mixed thing, please use our brand of PD5 inhibitor. And all our general practitioners are straight away writing without even understanding the problem. No. From the purely business point of view, every time you pay 1,000, whatever it is, 6 sessions, you are paying 6,000. Whereas if you take a prescription for 30 tablets of sildenafil citrate, you save much more money. Today 18 rupees per 150 ml sildenafil market, another bag. So it's cheaper for them. So in spite of the explaining, they still want only that. So you have to really make them understand only when they are willing, please do undertake sex therapy. Now what exactly sex therapy is going to be? Altering a previously destructive sexual system, sexual conflict resolution, evoking the emergence of unconscious intrapsychic dyadic conflict. See, you are walking in the dark. You don't know what is in front of you. So what do? You throw a stone. Depending on the sound you are getting, hitting against a wall, different sound. Hitting against a steel door, another sound. Falls on water, different sound. Then you know how to proceed further. Sometimes you do not know initially what exactly are the causative factors. So when you start sex therapy, first 2 sessions, slowly you realize whether you are on the right track of understanding the causative factors or in the wrong track. So that is really going to help them. The mechanism, you create a good ambience and relationship between the couple that will help them lose their anxieties. Then, if there is a conflict, that is resolved. The emergence of, I told you, intrapsychic and other things will come, opportunity for you to catch on to that and manage that also. Only then the therapy will be successful. I don't have time to explain all that, but I have to rush through because time is short. And with courtesy Prakash Patari, I am using this slide from him. This is his book, his doctoral thesis on PhD, published in African Institute way back in the 80s. Simple. I am telling you in simple terms, don't misunderstand me, you're all qualified, highly qualified doctors. I am not using technical words. I am going to do simple words because you can do the same word to your client. That's it. As you know, For a body to respond sexually, you require stimuli, physical and psychological. Right? You understand. Physical, you understand. Psychological also, you understand. Only when they join hand, they stimulate the sex center in the cerebral cortex. Only when this center headquarters gets stimulated well, impulses come down through the spinal cord and backbone to a low spinal sex center, L5, S1, S2. Only when that gets well stimulated, blood from the main body diverted and pumped into pelvic region, causing pelvic vasoconstriction. That is the pelvic vasoconstriction. In the man has got a penis to get erection, in the woman feel lubrication. The hallmark of male arousal is erection. Hallmark of female arousal is lubrication. That's what happens. Now, I want to give you an example of only man, but you can understand, imply that to the woman also. Now, let us assume there is a problem in both sides, either physical or psychological. What happens? The amount of stimuli the cerebral sex getting is only partial. The stimulation which is coming down is also partial. The flow to the pelvic region is partial. The erection quality is affected. Prakash has already explained erection adequate, not adequate, able to penetrate, not whatever it is. So that all depends upon the quantum. Right. Now, it is not sufficient if the stimulation comes initially. The stimulation should continue to come to the end till the act is completed with the same intensity. Otherwise, you get initially good erection, or your mobile phone rings up. People today don't switch off the phones in the night. And some idiotic fellow will call in the night. Today, I realized many of my doctor colleagues in Apollo, Chennai, they liberally use their mobile numbers to clients. And that fellow will have chest pain and breathless at night, 12 o'clock. He calls and disturbs this fellow. Instead of going to casualty hospital. I don't give my this one, mobile number to my client. And take on 2 more minutes, I want to talk to Dr. J. Bhatt why this happens. Once we were discussing in Pune, Bombay, of sexology workshop. So during the dinner time, we were all cracking jokes sitting. So somebody was asking Dr. Bhatt, how do you manage premature ejaculation? So Dr. Bhatt mentioned something. He was my physiology examiner at Stanley Medical College. So one night, one day around 11:30, on those days, no mobile phone. So a call came. A lady was panting. Dr. Bhatt, my dog and bitch are unable to uncouple. So please advise something. Dr. Bhatt said, Madam, I am not a veterinary sexologist. I am a human sexologist. So, that lady said, Doctor, I took him to the elder players. I didn't find any sexologist in veterinary side, so I am following on. Then Dr. Bhatt said, apply some oil, give some time, etc., etc. But whatever he said, the lady said, I have done all that. Still, they are not uncoupled. Dr. Bhatt was a bit sad. He said, Madam, please give me your phone number. I will call you after 5 minutes. When I call, you pick up the phone, they are automatically uncoupled. So, how is that possible when your call comes, they are uncoupled? Madam, that's what happened to you when you called me. This is Dr. J. Bhatt. So, any distraction, so what stimuli you are getting is cut off. So, stimuli will not be there. It is only partial and not complete. So, the entire principle of sex therapy decides on this. So, if you understand these slides of Prakash Kothari, you understand sex therapy in simple. He has told you something simple. I am also showing something simple. Thanks to courtesy, Dr. Prakash Kothari. Now, whatever may be the cause, schizophrenia, mania, wife not cooperating, whatever it is, psychological, I'm talking about not orthogenic factors, psychogenic factors. Ultimately, that thing is distracting him from getting involved, right? Am I clear? So, the stimulation is affected. Please understand. If you enjoy sex, Somebody has to be subjective, not objective. This is what happens. If you don't advise your client properly, but prescribe the international ban, VIA, GRA, 100 milligram, still he'll come and complain, Dr. Reddy, this is not working for me. Why? So I went to Dr. Reddy, he spent half an hour asking all these nonsensical questions, and he also made some tests also. I spent 5,000 rupees on the test also. And then finally he prescribed the international ban. 500 rupees tablet I got, in spite nothing is happened. Now what is he doing? I spent so much money, I taken there, let me see whether I am getting erection. Instead of looking at his partner, looking at his penis. He is become objective. Once you become objective, the person cannot respond sexually. He or she has to be subjective. Right? That's very important. That's what is right tells you very clearly. That's it. Now,
can you just ask one question?
Question afterwards, please afterwards.
Just
Afterwards.
one. This is
No, no,
relevant.
afterwards.
Just
Afterwards.
relevant.
After everyone is asking.
okay. Now, how do you distract the distraction? The principle of sex therapy is distracting the distraction. How do you do that? Simple. Telling the client, oh, I examined you, laboratory investigate, everything is fine, don't worry. It is not going to work. The fellow will say, Dr. Reddy, you are talking like this. Ultimately, when I go home, my life and my life. What to do? So don't tell him, don't get worried. You have to give a method by which to overcome his worry, his concern. That is the principle of sex. I will tell you a real story, and those of you who are familiar with Vijayanagara Empire, Krishnadevaraya, and Tanarama, a wonderful thing, the stories. I would recommend all of you to read two things, Panchatantra, Tanarama stories, and Aesop's Fable. Excellent psychological input there. Now, are all of you know the story? All of you know the story? Or not?
No.
No. No, Tenal Raman is a court, but a quiet, highly qualified poet and jester also. So one day in the Darbar, Krishnadevaraya, the emperor, he is given a riddle. If everybody knows cat loves milk. If somebody can show me a cat which dislikes milk, I'll give them 1,000 rupees or whatever it is. Everybody thought the king has screws. But since the king, they kept quiet. Tenal Raman put up his hand. He said, oh emperor, I'll show you, but I need 1 month's time. Everybody thought this fellow got a death warrant. He thought that. What he did was, while going home, in the bazaar, he bought a cat. Took it home, starved it, dying to drink some milk. At that time, he gave them milk, sizzling hot milk. The cat ran, put his nose, singed it. Every day for 30 days, he did it. On the 31st day, he took the cat to the darbar. They gave white milk. If I show you, I draw a line, ask you to make it small without touching it, how will you do it? Yeah, exactly, correct. So a therapist will not say, don't do this, don't get worried. He tells you that you do something. And that something here is sex therapy. So the sex therapist, what he does is, divide the sexual act into simpler steps. There are 5, 6 or 6 steps. At each session, he explains one step. When they go home, in the privacy of their home, they practice what you tell. They come back and give you a feedback. Based on that, you decide whether you clarify certain step 1 or you can proceed to section. That way you have to do. That's how sex therapy is undertaken. Mind you, sex therapy cannot be undertaken a single individual, single client. It's a couple therapy. 2 people are required, a man and a woman, in Indian situation, preferably husband and wife. That's very important. Now, I will rush through sex therapeutic strategies which later on we can discuss later or explain. Inhibited desire, all Kaplan's is done. Sensate focus on demand, sensate focus demand. I don't have time to explain. Orgasm on masturbation, explore the fantasies, share erotic material, non-demanding information, data sex treatment. See, the greatest contribution of Marcus and Johnson using the word sensate focus. What he did was, client is worried about performance. He shifted the focus from performance to sensations by touching each other, to feel. So it's called focusing on sensation, sensate focus. Kaplan uses the word questioning exercises, but ultimately the same. For erectile dysfunction, simple. Like when you go to a physician, Italy fever, what does he do? Takes a prescription pad, he writes an antipyretic, and then he goes there, chloromycin. Today he has ceftriaxone, and then he also had a probiotic. Right? Also in one system. Like that, sex therapy takes RX and right. Erotic before erection is sensate focus, erection with orgasm, sensate focus demand, extravaginal, interruption, and body. About this, I don't have time to go through every single step. And this is for premature ejaculation, stop start, which was practiced by James Seaman and Martin Johnson to a squeeze technique. Then, retarded ejaculation, Prakash had delayed orgasmic response, but those people in the West still use the word retarded. Unfortunately, their voice is larger than ours because pharma companies fund them. They don't fund us. That's why we are not able to put internet and make. In fact, again I'm repeating, not because I know him well, but his history taking is the best as of today, in spite of so many years. Then, female excitement, orgasm, vaginismus, and over. You must tell them what they should do. Provide a structured approach which allows them to rebuild the sexual relationship. Prakash company has told, which I have been following for the past 40 years, and I have been found it very useful to me. Second thing, Dr. Bambart was talking about communication. There are two important things about communication. I want to come and tell you, even though it is not directly linked to my talk. One, Bambart was talking about communication. I will use the word communication with reference to sex. Now somebody asked somebody to define what sex is. What sex is? Somebody said, two people are having intercourse, this, that, and all that. But the best definition I can understand, I forgot the name of this author, wonderful definition. He said, sex is the most intimate form of interpersonal non-verbal communication.
Wow.
It's the best definition I can really know. And Bambart was again talking about Krishna. Those of you who have listened to Swami Chinmayananda, what he used to say is, Krishna, Lord Krishna, the world's greatest psychologist. Not the first communist, world's greatest. And see, how does a counselor help a client? The client knows all the solutions, but he or she is unable to decide which solution to take. So Arjuna had the same dilemma. Teachers, father, grandfather, etc., cousins, everybody there. His duty as a Pandava principal warrior is to kill them and win the war, at the same time as killing everybody. He knows in a war you have to fight and win. but it's taken up. So that confusion every client has got. And Chinmayananda calls it Arjuna disease. Every one of us who got a doubt is for suffering from Arjuna disease. So Arjuna, Sri Krishna has helped him to counsel, to gain back his balance and decide his choice. I will go into this one. Identify the specific factors to provide a couple of specific techniques to deal with particular problem. One mistake that people do is doctors or therapists, they focus at each step, they come back. You know what the first question? What did you practice? Yes, doctor. Did you get direction? Never ask that question. Again, they are focusing on performance. You have to ask them, what happened? How did you feel? Then it is open-ended. Then they come, then only you have to go. One thing again, I take half a minute more. People question me, Dr. Reddy, we are highly qualified, educated. Is that you are going to be taking money from us? So touch each other. We've been married for 3 years. Are we not touching each other? Isn't it? Somebody may ask you that question. My explanation is, if I give you a cup of tea, how will you think? One, you drink, gulp it, run to catch a train or bus or flight. Second thing, you say, wow, touch, sip by sip. So far you touch each other to get direction, complete that. I am not telling you, do not attempt intercourse. You are touching for sake of touching, enjoying the entire body. That's very important. Like that, you have to keep on clarifying them. Proper rules for sex therapy. Clear-cut instructions and make sure they understand. Ask them to repeat what you told. Otherwise, what happens, they don't understand. They understand it wrongly and make a wrong therapeutic procedure, come back left, right. Ask about what you obtain detailed feedback. If you have something wrong, don't get agitated, worried. Take it. If something is what you get, what is it? How do I avoid? That's very important. Then you admit the phase of therapy means this couple. Martin Johnson asked the couple to take 2 weeks off, stay in a hotel. Today you and I cannot do that. Depends upon whether they are inside the city, outside your city, or how. The inside city maybe give week or 10 days. If they are from distance, give 2 to 3 weeks time. They will not come back. Now, it is not as simple as that. If you are really going to be a good, dynamically oriented sex therapist, then they employ an integrated combination of sexual experiences and psychotherapy. Without psychotherapy, you will not get 100%. How exactly this works? Structured sexual experiences, which I mentioned in the slide, they produce specific sexual difficulties. Synergistically, if it's possible, you undertake, otherwise you take the help of technique. Find my ups and downs. Have you seen the movie Diva? Amitabh Bachchan? What happened? Amitabh Bachchan wants to become a bad guy. He stands in front of the mirror. His conscience comes into that. There's a dialogue going between, shall I do it or not? He has become his own spectator. So when a man is looking for direction without fire in the bedroom, he becomes his own spectator. That's why it's called spectating. That's why I said, you have to be objective, subjective, not objective. Then, guilt and shame. Oh, why this happened? Because I masturbated too many times, I become guilty. The shame, I'm not man enough. Anger and frustration. Why me? All my friends this year they are doing 10 times a week, I cannot even do once a week. Then, on the partner side, there is no communication. If I approach him, he will want to fail. Why doesn't he forthcoming? Then, pressure to perform. He may put pressure. He must definitely understand this if we are treating gynecology infertility cases. Now, what happens is they get married next month, the woman doesn't get married. Doesn't get pregnant. I'm sure it must be happening in the western part of India also. The southern part, the both sides parents expect the girl to become pregnant by end of first month. While walks a war between the parents. If my daughter doesn't become pregnant, the boy side may accuse my daughter of some problem. In fact, so they want to. The boy side is worried. The girl doesn't become pregnant, they may accuse my son of some inadequacy. So they put pressure. So the wife will say, what is this? At home you could not perform. They went to the doctor, top gynecologist, and they did all the tests for you. And they wanted you to produce a sample of semen on this day. Till that day, fellow will get erection. On that day, he paid to get. And she could almost catch him, the father. What is this? My father gave you so much dowry. And doctor consultation, my father paid. But even to do this, that's it, is over. Question. It is about hostility. And give self-name, probably I am not attractive enough. How do you manage that? Simple. The judgment was a wonderful thing. He said, how do you deal cognitive restructuring, modifying expectation, teach communication skill, treat physical problems. Then, correct physical problems, psychological treatment, crisis intervention, very important, and treat the partner. Dealing with perpetuating factors, said, reassure. Failure does not mean only once, you will be successful later. And redefine what is meant by success. Fun rather than performance. Professor Patari clearly told. The journey is more pleasurable than the destination. Same thing. Fun is better. And then learn to express anger, but in a qualified manner. I forgot the name of the author. I can put it left on the Sexcon group. It's a wonderful book by forgot the author. Couple arguing. He said, don't argue. If they don't argue, it's a dead marriage, dead relationship. They have to argue, but learn to respect each other's feelings and take it as a positive. Wonderful. Then, from the partner side, encourage communication, ease the pressure. If you put pressure, he will fail. If he fails, you are also not getting the pressure. It is in your own interest that you don't do. And then finally, concentrate on relationship. Relationship is more important than performance alone. And finally, reassure. Because the comfort of saying, always be positive, don't be negative. Now fine. Self-promotion. Whatever I told you is given in this book, Sex Therapy. Available on Amazon. Whatever I spoke to you, they are given more in detail. And if you have any doubt, during dinner time, you can ask me questions. Thank you very much for your attention.